that's on the living room, dining room area. So like I hear everybody coming through.
Hello to everyone who's here already. We're just going to wait a few more minutes to let people roll in a little after the hour, as per usual in the academic world. So just bear with us for a few minutes and then we'll get started. Okay, well, we'll go ahead and get started. I'm going to stop my screen share here. And I'll take a couple of moments to introduce our guests to everybody this morning, or afternoon, I should say. And then we'll go ahead and get started. So the general format today will be that I'll introduce Dr. Madden, and then she's going to run through some of the sort of key points and talking points from her great piece of work that we're reviewing today. And then we'll have the floor open for a question and answer session and discussion for all of the attendees. So we hope that everybody feels free to engage in conversation. I do have some questions already in the hopper for the silent times, but please feel free to hop in. So that can look like a couple of things as well. So along the way, if you have a question, you're more than welcome to raise your hand using the Zoom function and unmute yourself in case I don't see you. And we're happy to call on you digitally. And the other option would be to send either an anonymous question or a question to everyone in the chat. Any of those options is completely fine. So I'll start off by saying welcome everybody to another Global Journal Club. We're excited today to host Dr. Meredith Madden. Dr. Madden joined the Faculty of Athletic Training Education program at the University of Southern Maine in 2018. She earned her Bachelor in Science in Athletic Training and Doctorate in Education from Boston University in Boston, Massachusetts, her Master of Arts in Psychology from Washington College in Chestertown, Maryland, and a Certificate of Graduate Study in Healthcare Quality and Patient Safety from the University of Southern Maine's Muskie School of Public Service in Portland, Maine. Dr. Madden has a diverse clinical background, providing athletic training services at the high school, collegiate, and semi-professional sporting levels in urban and rural communities and among different socioeconomic settings. She loves to keep her athletic training skills current through per diem coverage at various colleges, as well as serving her community at volunteer opportunities, including marathons and the Special Olympics events. Her passion lies in her service and leadership activities in the athletic training program at USM and to the profession at large. She currently acts as the NATA District 1 representative on the Professional Development Committee, which develops continuing education for athletic trainers and is the state of Maine's lead for the NATA-AT's Care Commission, which coordinates peer-to-peer crisis management. Additionally, her passion for service intersects her research interests, including concussion education and partnering with the Special Olympics of Maine to improve healthcare quality and access for people with intellectual and developmental disabilities. Dr. Madden's current research interests and projects involve concussion and concussion education, health promotion and injury recognition and management in athletes with intellectual and developmental disabilities, use of telehealth in athletic training, healthcare quality, quality improvement, patient safety, and interprofessional education. And we're grateful that she's taken the time to join us today for our Global Journal Club. We're also going to be speaking about her recent work entitled Lessons Learned and the Potential Long-Term Impacts on Athletic Trainers and Clinical Practice After a Global Pandemic. So at this point, I think I've talked enough. I'm going to pass the microphone over to you and turn my lights back on somehow. And let you sort of lead the way in terms of getting us started with some of the main takeaways and perhaps the impetus behind this study.
Yeah, sure. Thanks, Sam. So this study actually kind of morphed over time, and it started off as a research question about how do we support athletic trainers as we continue to add skills and roles and responsibilities onto their plates. And then the pandemic hit. And so we saw the opportunity to kind of see how those roles and responsibilities added on to athletic trainers, daily tasks would impact them in terms of that organizational support. We know work-life balance and those pieces are kind of hot topics in the profession. And so kind of looking at those aspects of the pandemic. And this was at the very beginning. So, we were able to kind of collect within that first few months and, semester or season of how this had impacted clinical athletic trainers. And so some of the key things that I find really interesting that we found were it was kind of polarizing. We found a lot of kind of paradoxes in it some athletic trainers adjusted very well and found, kind of those silver linings that they were able to find some work-life balance or able to improve their skill sets or add new skills in terms of the infectious disease kind of pieces of it or working interprofessionally. And some did not. It was, when you're in a small staff or you're still needing to continue your patient care on top of having to, apply all the COVID new policies and protocols. And then the other thing that we kind of found was that value of athletic training and how the pandemic increased the value of athletic trainers in some areas, and that it really kind of, for others, showed the cracks that there wasn't a lot of value being placed on athletic trainers, especially those who were either terminated or furloughed, and their positions weren't continuing through that. And then we looked at kind of what did they learn? How did they adapt? And kind of looking at those quality improvement and like patient safety pieces. Some people started to learn how to use telehealth. Some people started to schedule and really kind of create better balance in direct patient care because of social distancing requirements. So it was just really interesting. We found a lot of data, I think, and I hope that it can be used for those athletic trainers who are trying to demonstrate the value of the profession, and that our skill set, is above and beyond what people maybe initially think of.
Fantastic. Thank you very much. And I guess at this point, I'll ask the first question to sort of start the wave, and then everyone else, please chime in if there's certain things you'd like to ask or discuss. So my first question is, in what ways were the pandemic-related stressors and factors associated with burnout similar to those pre-pandemic or separate from the pandemic itself? And then also, at the same time, what was unique about those pandemic stressors in comparison to some of those?
Yeah, like I said, I think it started to show those cracks a little bit that, we're already in the system of, a lot of athletic trainers were trying to manage schedule changes. How do you still cover events while still needing to now do these additional contact tracing, COVID testing, just clean facility maintenance, like those kinds of pieces that just took the extra time that we didn't already have in many settings. So I think it did show kind of that original research question, like what does this look like? What is the organizational support that athletic trainers have to be able to kind of do our job well? And adding that like one last, card onto the house of cards just kind of was starting to make it tumble down. And then we did find that specific to the pandemic, a lot of athletic trainers their roles and responsibilities were kind of being diverted from patient care, right? From the things that we enjoy in the profession and building those relationships with our patients and having that continuity of care, because it was predominantly doing the COVID testing, the COVID contact tracing, coming up with policies and procedures. People would say like enforcing those rules like mask police. So I think those were sort of unique to the pandemic and just took over from the normal patient care roles and responsibilities.
Great, thank you. Are there any questions from other attendees at this time? Yeah, Joseph Murphy.
Hello, I think this is really valuable work, and I think it's important we spend a lot of time kind of looking at these, how our lives change from the pandemic. How have you seen, as we start to roll out, has this, what we've been calling on our campus, this job creep of more and more responsibilities? Have you seen that like lessen, or have you heard from people that this is now just an acceptable part of their job and more responsibilities are just going to be added to positions?
Yeah, I think that was a major thing people were saying was they're adding to the responsibilities, but not compensating those extra responsibilities and not taking anything from the responsibilities in order for there to be space to do these things. As well as even just really sitting down to look at, like, is the athletic trainer the person who needs to be doing some of these responsibilities, or could they be redistributed to other staff? And if we think about maybe that traditional setting in athletics, can the coaches or the athletic staff be assisting more in some of these tasks, like enforcing rules, helping with testing? In some places I think do that, but it was just another thing that the athletic trainer had to prioritize over patient care, and not be compensated. Some people said that they got like a one-time bonus or some hazard pay, but it didn't really extend beyond those initial maybe months or phases of the pandemic. So, and I mean, that's really where this project started from too, not just with the pandemic, but we're asking athletic trainers to do more and more and more all the time without the compensation or the kind of readjustment to what a job description looks like, or hiring more staff to do it, right? To spread that around.
That's great. I guess I have a follow-up based on that. I think, Joseph, you brought up a great point, this idea of the job creep, right? And how do we as athletic trainers professionally avoid that, for one, and really who does that burden fall on? Should that be at the individual level? Because that's probably different from institution to institution and from role to role that an athletic trainer plays. But do you think, and this is, I guess, for the group, not necessarily just you, Dr. Madden, but do you think that this is something that should be almost a grassroots effort, versus should there be communications with BOC or Katie to talk about what really role delineation? And I know that there are efforts going on now, and And it's been difficult because athletic trainers can do a lot of different things, and that's good, but maybe the double-edged sword here.
Yeah, I mean, I don't think it needs to just be one, like the responsibility placed in one area. I do think a systems like thinking approach is really important, where it's at that organizational level to anticipate these, maybe you can't anticipate a global pandemic, but you should actually, right? Maybe you should be anticipating that. But at least now that it's happened, for organizations like at their institutions, right? Like at that kind of smaller level or that more individual level, to like think about what just happened and how can they still provide quality care, right? And when we think about quality care, we have to think about the provider well-being as a part of that equation now too, right? And so if we're not taking care of our clinicians, then it's going to start to impact, the patient experience, patient outcomes, costs, right? If people are tired or having too many things to do, mistakes start to happen, right? Or things get kind of bypassed. And, sometimes maybe that's the approach that you take to an organization, like ultimately, like this will cost you more money if you don't just anticipate it at the beginning. Professions should probably, yes, like the NATA, BOC should be thinking about it and addressing it. I can't speak for them. I don't know what that would even look like at a professional level, but I think there is some work being done on, the salary and compensation pieces, tools to advocate for additional positions or reworking job descriptions and, helping athletic trainers to practice at the top of their skill set. But that's hard at those individual levels when you don't have that support or those resources to be able to do that. And I think that was part of it too, is the athletic trainers, we're just trying to get through the day, right? To take care of our patients. And we saw that, in some of the qualitative is, even though this was hard on everybody, many of the clinicians' primary concern was their patients and how the patients were handling it. And so I don't think that we're very good at taking care of ourselves either, right, in this profession. And so I think we do need that support to be able to provide quality patient care, safe care. And who knows what that looks like at different organizations. But there was also the kind of theme of interprofessional collaboration and those pieces. And so again, redistributing, or how can we share the load with who's more qualified to do which pieces, right? Or that continuity of care piece. And that's typically a resource that's around. And so maybe organizations can start helping to foster those relationships between, in that healthcare umbrella in the organizations to ensure that, work is distributed and everybody's working together. That would be my thought on it, but I'd love to hear what other people think.
Yeah. Yeah, Joseph.
I think it's important at the organizational level, and I also think it's important as I'm in education. We talk to our students about this a lot. Of when you're interviewing, talk about work-life balance. Talk about what are your extra responsibilities are going to be outside of patient care. And I've started filtering jobs. I send, so when a job comes to my desk as a program director, I send an email back with kind of 3 or 4 stock questions about the job. And if it doesn't match our expectation, I don't even forward it along. I politely send them an email back saying, thank you for sending the opportunity, but it doesn't mess with our program responsibilities. And I kind of move on with the day. But I think we can, as we grow these athletic trainers, I think we can kind of build this into them too.
Yeah, that's an interesting point, because I feel like what is being asked in addition to typical duties probably falls under the other duties as assigned by the director of sports medicine, right? Which is there, I think, in part to be a catch-all for stuff like that. But yeah, Meredith, are you?
Yeah, so I'm not an athletic trainer. I do concussion research, often with Meredith, who is an amazing collaborator, by the way. But I don't want her to go collaborate with everyone else and not leave time with me. I'm just kidding. But I think part of the answer to this question is increasing awareness, which was a big goal of this particular research. Was really I think on campuses, people aren't always aware of what athletic trainers do. I think the old school, very old school understanding of what athletic trainers did, and I do not want to offend anyone, was tape some ankles, send you out on the field, and that is so far from what athletic trainers do today. I mean, so far. And again, my understanding is so surface to what your understanding and knowledge is, and I have so much respect for what athletic trainers do. And I think part of this research comes from my knowledge of concussion work, which was, sitting in meetings and thinking, wow, athletic trainers need to be experts in concussion and ankles and knees and shoulders and wrists and elbows. And then when you started adding it up in my head, thinking, wow. And then also really the mental health of the athletes, and then they need to be able to converse with coaches and with athletic directors. And once you start down that path, that you realize how absolutely incredible the role of the athletic trainer is. And that's from an outsider's perspective. But I think, and this is from a college campus perspective, as somebody who's just walking around on a college campus, they are not always aware of how much an athletic trainer is doing. And I'm not even sure that administrators outside of athletics are aware. And I think that's what some of this research found, was that there is sort of undervaluation of that. And the other part of it was what actually happened, like the reality of what happened in that 2021 year, where all the sports got smushed into the spring season. I mean, I'm not sure. I mean, so even if you kind of knew that, did you understand what the impact was on the athletic trainers whose staff may have been reduced? I know you're shaking your head like, yeah, we lived it, right? Like you guys were living it. So even if you were aware of that, were you aware that the athletic trainers were testing every athlete every day, in addition to, overseeing every single sport that they normally weren't overseeing, like all of those factors that, and everyone else was sort of running around campus, like stressed about having to put their courses online. So I don't know if everybody was sort of aware of all of those things, and how do you make people aware of that? Because they were so busy with their other things. And there does need to be awareness of it. And I don't know the answer to the question, but part of it is getting this kind of research sort of blasted. And so we're certainly appreciative of this kind of forum where we can make sure that it's well publicized.
And, just to play off of that, when we talk about mental health, everybody was concerned about the mental health of the student athletes, which, yes, there was a huge impact on patients. And so a lot of athletic trainers talked about needing to be aware of that moving into the future, and beyond the pandemic, that this might have long-term impacts on the patients, but also just the well-being of that provider. I'd like to kind of come back to that point, because there was also that hard spot that athletic trainers were in, because they were having direct contact with everyone through testing. And if a test comes back positive, well, and it almost created that fear of exposure and put them in this place where they had to decide between work and either their own health or exposing their friends and family. And that's really critical, because when we talk about how this all started in terms of support systems. Well, now we're literally putting athletic trainers in a place where they're choosing to protect their support systems by, they would not go home, or they, hadn't seen friends, family, whatever in months, because they were afraid of exposing others. And when they got sick, some of them were put in an interesting position of not having PTO, or, and so again, it came down to this livelihood, versus, taking care of yourself. And I think that needs to be a priority, for the profession as well. And I think it is, we have the work-life balance position statement. There's that whole line of research, happening. But I think, Meredith and I have been talking about like the cumulative effects of this pandemic too. So not just in those moments, but it didn't get any better. And and like sometimes I'm like, I feel like more exhausted than I did at the beginning. And so we've talked about that. And even on social media, some of the athletic training, groups and forums, people are still looking for resources on how to deal with the pandemic, because it's still here, right? Whether we want to believe that or not, right? And we're still in it. And so people are still searching for resources. And I think that is important, for us as a profession, or healthcare, just, it's not just athletic training that experience this either. How do we take this lesson and really refocus, and what are the resources? Some people had access to mental health, like counseling and, those kinds of things, but we also saw a lot of athletic trainers who were reporting unhealthy coping mechanisms as well, which are going to have additional long-term effects. So I don't know the answer to that question, but I think it just brought to the surface again, like, what resources do we have out there to support our peers and, our colleagues and students, right? We see it there. They also were in clinical sites and basically just doing COVID testing for months on end, and having to see that and be part of that as well. And the stress of maybe clinical sites being shut down and not being able to continue and move towards graduation. And so I think the student population is another really critical group of athletic trainers that this pandemic has affected.
Yeah, I think it's really interesting that you say, there's burden on the clinician who is generally empathetic toward what their patients are going through, and covering all these bases in the changing landscape from the pandemic. And I think very salient to say that things have changed, some of them long term, as a result of that, while other things maybe are getting better for some people. But at this point, to still be seeking resources, clearly there's still a need. So do you have some insights on what resources are available for people who are seeking for help?
In terms of mental health, plug my own work, right? AT Care, being part of that group was very busy in those early days of the pandemic, and doing a lot more maybe proactive, handing out those resources on resiliency and those kinds of things, and checking in a little bit more with our colleagues. But that almost, kind of petered out as well. And obviously we're still available for like the crisis piece of it. But, those resources were out there. I don't think they've really expanded or changed just in terms of like developing resiliency. But again, like we're putting one more thing, right, on an athletic trainer's plate is like, okay, now learn how to take care of yourself, right? So it's not always the best. Or find time to like, find a mental health professional or go to counseling or whatever it might be. And, they're strapped and there's a shortage there as well. So,
Right.
But so in terms of that, that's the first thing that comes to mind. In terms of like broader tools, I think not necessarily they were maybe available during the pandemic, but that we're starting to see is the telehealth. I think there was some very early research, that kind of aligned with the pandemic there, but the telehealth skills haven't really kind of, I don't know, permeated into all clinicians where it's become a resource that they feel comfortable using. And again, there's cost and, to that. And I think people started to realize maybe like again, I'm just, plugging all my own research, but, the telehealth and the QI pieces. And, I think, again, making sure that we are making those resources aware, like how to write policies. I know the BOC put out newer like templates or guides on how to write policies and procedures. There's an infectious disease one specifically in there now. So I think helping athletic trainers with the healthcare administration piece of it to help develop systems that help protect them, right? Or protect at least their energy, or get those resources. How do you get more resources? How do you advocate for that? Well, someone's going to have to do a little QI project, right? You're going to have to demonstrate that need to your administrators to start to get to that. And again, I don't think we're quite there yet in having those resources well known, and it's really starting to gain momentum in athletic training. And I think it will be useful, but again, it's seen as one more thing we have to do, right? And yes, you have to front load, and hopefully it will create that space, on the back end of it. But it's that delicate balance of like, how do we help each other without continuing to add to the plates, of our clinicians. So I don't know what the answer is. If anybody has any suggestions, please.
Sure. Yeah, I guess that's a good question for the group, right? Were there resources that you utilized or that you've been able to share with your students or colleagues in any way throughout the pandemic? Or even more recently?
Sometimes it's simple. I think Meredith's suggestions are excellent. I think the QI route is great, and we love seeing her work in that. Sometimes a very simple suggestion, which we sometimes forget, is your employee assistance programs. We forget to kind of utilize that and refer our colleagues to those. And you are absolutely right. Getting mental health assistance and accessing that care is very difficult right now. Finding a provider, but the EAP often can connect you to somebody more quickly than the find a therapist and calling individual therapists and getting that connection.
Right, and I think that bodes for remembering we've got some of an international audience to this too. I'm sure that it's not unique to the United States of America that employers should have some sort of access or network to lean on there, and if they don't, now's a good time to start doing that. Really, it was years ago, but I guess kind of like what you're alluding to, hard to recognize without first looking for where there are gaps and needs. Does anyone else have thoughts on available resources or what you've used or referred people to over these last couple of years?
And I'll speak a little bit to education, and I think Joe has kind of talked to that a little bit, but like changing the culture of athletic training is going to be quite the task, right? And so if we can start to change it with our future clinicians or our early professionals, and start to say like, it's okay to say no, or it's okay to take care of yourself as well, and helping them to, find that balance, and balance is different for everybody as well. And so I think helping students to do that, because students can also, when they're at clinical sites, help model that, or bring some of that information or those resources to preceptors. Not every clinician's a preceptor, but I think students are a valuable resource, right? Because we have a little bit more flexibility in saying like, it's okay to do those things, or it's okay to try to recognize the things that, we could change in clinical practice or making small changes. I think so. Our students are probably another good resource.
Yeah. So I think it's a good time to maybe pivot and run with that. So I see now we have 3 out of 3 authors of this paper here on the call. And so I'm wondering if you all could speak to your thoughts on many of the athletic trainers who completed the survey reported that they gained new skills that they're going to carry with them moving forward. And so I'm wondering if maybe you can talk to those points and say maybe what some of those skills were, or the lessons learned there that they can use, and maybe that we should start thinking about employing with educating the next generation or two.
Yeah, so I think a lot of those broader skills that, I mean, obviously they learned new COVID related, right? Infectious disease related skills like how to test and those kinds of things, how to contact trace, but also how to work interprofessionally to, on those task forces that were created to, create the policies and procedures or the systems in place. I think that was something people talked about. People who were redeployed were trained, in whatever the new job description kind of was. So they were able to kind of expand along those lines. That happens a lot more, I would say, like in the clinic or hospital kind of physician's practice settings, where they could be kind of inter-transferred, they'd be still in their own system, but just doing different things. I don't know, Meredith or Tom, if you had other.
Scheduling in the training room, sort of having a more scheduled, systematic way of getting the training room lined up, rather than I think having just complete drop-in hours, which is good and bad, right? That was one of the things they said. Tom?
Yeah, sorry I was late. I was across campus and the Zoom app on my phone just totally, anyway. So I apologize for hopping on so late, but yeah, so I think one of the other things was just knowledge of cleaning protocols and things like that. And it seemed like a lot of the participants talked about, you know what, we weren't really doing a good job of cleaning, and now we are because we have to be. And we'll carry some of this stuff forward. The scheduling was another thing that came up, made time much more useful for them because they could schedule patients a little bit easier.
Yeah. And then telehealth. That piece as well.
Yeah, which they'll carry forward, I think, into the future, which makes more flexibility.
Right, and has, I think, direct applications to more than just, screening for things like this. But I know there have been recent studies in the role of telehealth and concussion assessment for student athletes who maybe don't have access to an athletic trainer. Can they get access elsewhere? Yeah, that's a great point. So, and
not necessarily a skill, but people talked about updating or sort of adding on to PPEs. So including that mental health screening, as well as starting to think about long haul COVID. So if there's cardiac or respiratory conditions associated with that.
Right. So it's a permanent change in screening for the long-term effect. And do you think that also will help inform how we manage some other conditions that we suspect might have long-term issues? It's a leading question.
Maybe. I don't know. Because I mean, I feel like that EKG, like the cardiac screening topic has been around for a while. And so I think that'll probably take direction from cardiology and like physicians recommendations on that, because I think back in the, back when that was a question, it was decided it wasn't really, relevant to screen everybody for those conditions if there wasn't. I hope that we don't have another pandemic very soon in which we have long-term health complications, but who knows what we'll find even based on this years into the future too. So I don't know if Tom or Meredith or Joe has other thoughts on it. My own curiosity would be, how will the, settings like high school, secondary school, who already are tapped when it comes to PPEs, how will they screen, more effectively and efficiently for just long haul COVID? Because many will just, have them go to their PCP. And so our PCPs doing those types of screenings, I don't know the answer to that. But so I think it'll be trickier for the, settings that don't have those resources already in place as well.
Right. And I think that was one of the reasons behind not recommending widespread EKG also was access to being able to do that and read it, and who's going to administer it and who's going to pay for that. And what happens when you find something and who's going to pay for that, given that it's it would be a pre-existing condition. And so, yeah, and that also speaks to the United States. I'm actually not familiar with how people do their PPE in Canada or the UK, or other places where there's athletic therapy and sport rehabilitation as a profession. But I know that they tend to have the same, at least educational standards, and therefore very similar practice standards in a lot of ways. But the sporting environment is different. And so there's certainly a lot of considerations there when a club is paying for all of the medical services who are under the direction of that club's owner versus athletic administration versus a hospital setting where there might be almost an expectation to screen and refer in some situations too. Certainly that muddies the water a lot. So to shift gears a little bit again too, I know that coping strategies for better or worse were another major theme that stuck out. And I think that also potentially relates to the presence of or lack thereof in a semblance of work-life balance. And so I'm wondering if you could speak to not just your findings from this study, but what do we carry forward in terms of how to help people manage and recognize, areas for improvement?
It's a loaded question as well.
That's why we're here.
Right. I mean, I think, like I've said, we've kind of talked about like, okay, actually, what are the next steps of this? And, so I think more research. I would like to see more practical. I think when we talk about, again, going back into kind of like a classroom setting, but like we talk about work-life balance and we look at the, literature and what their experiences are, clinical experiences, and with their preceptors talking about those things. And I think it's the how do we do that, right? And it's different for every person. And so I think, again, prioritizing, like we're not great at it, but starting to shift that culture of like, you know what, like let's check in on ourselves, let's check in on each other. I think obviously like the additional staff, additional resources, those kinds of pieces can help, where we're decreasing some of that burden. And I think if we're looking at how many more tasks we keep adding on to the athletic trainer, well, we're going to need to add more athletic trainers, right, onto a staff in order to kind of help create that balance. So people can take, a day off here or there, or have a 40-hour work week or something like that. I think the athletic training profession is encouraging the medical model as well, like from kind of that higher organizational level that I think supports that better than our traditional athletics model. I don't know, and maybe providing more, I don't know, I say more resources, but like, what does that look like? Is there a toolkit that you can put together? I don't know, maybe. I'm going to throw it to Meredith because part of her expertise is in stress, so in psychology. So bounce it over there.
Yeah, but I think, athletic trainers are, they're aware of what negative coping mechanisms are. And I think almost in some ways a bit apologetic about their negative coping mechanisms that they shared with us. But I think we were quite, I don't know, both surprised and happy that they were so honest with us about the coping strategies that they were using. They certainly very honest about both the positive and negative and maybe negative is not the right word, but it was less positive. You know, but people were very honest. You know, I mean, people were using exercise and social support and, you know, the things that, you know, meditation and even prayer and things like that.
Mhm.
But then other people were saying, you know, smoking and drinking, and, you know, and they were very clear, like, I know this isn't right for me. So it's not a lack of knowledge. It might just be a lack of how do I access the, you know, something more appropriate, or, you know, how do I incorporate it? And so I think maybe it's giving people the right ways to utilize it, and I think maybe the time. You know, when we combine it with the other piece of what we were finding was that they were working way extra hours and overloaded in other ways, and you know, it seemed like it was more that than anything else. So I think maybe an exploration of the why rather than the what might be the question, because I don't think it's a lack of knowledge, you know, which
Right.
is, you know, most of what we know in our field anyway, right?
Mhm.
It's not knowing, because I think athletic trainers are smart enough to know that that's it. They aren't effective coping strategies, but
Mhm.
you know, so getting at the root of the why, and then how do we support more positive coping strategies. And I would always plug for social support being really positive.
Yeah, I was just thinking that too, because one of the things you found was a lack of social support, right, from family and friends, and perhaps that would be a moderator of the decision of which sort of coping mechanism you use. And in some settings, it may not change, but in many other cases, just being around somebody else who's maybe also going through similar things, then
Right.
there might be less of an urge to make those selections versus something that we know is helpful and we'll also do it. But I'll hold fast to this notion that athletic trainers are really good at knowing and not doing. We're the worst patients possible.
That's a lot of people in the medical field, though.
Yeah, sure.
But you know, I think
Yeah.
you know, added in to that was the social support, particularly was that it was the pandemic. You know, so it was very
Right.
difficult for people to access their social support
Yep.
networks. And as Meredith said earlier, you know, some of that was the not wanting to, because of the high contact with people,
Right.
particularly people who were in the sort of, I mean, the bubble was so large because they were athletes who were, you know, 19, 20, 21, who were in contact with each other,
Mhm.
not wanting to bring anything back. And they did express that to us, you know, I don't
Right.
want to bring this back to my family. So then they were self-limiting their social
Mhm.
bubble, in their family bubble for a lot of reasons, you know, so that may have been a big component of it.
Right.
I'm sure Tom has some good insight as well.
Yeah, you know, some of the things, it's a gift and a curse, right? Thinking about work-life balance, telehealth is nice in the sense that now all of a sudden you can provide care from wherever you want to be. Whereas traditional athletic training has always been a coverage-based profession, right? You have to be there to do it. But I think it's also a curse because now you're truly on call 24/7, and people can get a hold of you whenever they might need something. And if they have a contact trace come back and it's 2 a.m, you're probably going to be the first person they contact, regardless of what time it is. So,
Right.
you know, I'm hopeful that we'll take the things that work well and we'll, you know, try to create the boundaries and the other things that the work-life balance position statement brings up, and you know, move forward that way. So yeah, telehealth gives us some flexibility, but that doesn't mean we're on call 24/7. So you know, these are the hours that I'm available via telehealth, and these are the things that I can provide and that sort of thing. You know, because athletic trainers do have lives too, right? I mean, they have family obligations and friend obligations and other things that need to happen. So, you know, is it possible to give them a little bit more flexibility to be able to go to some other events that traditionally they used to miss because they had to be in the office.
I wonder, building off of what Tom said, and you guys can answer this much better than I can too, I would suspect that the reason people get into athletic training is because they want to engage in that interpersonal care, patient care, right? So when you pull into telehealth, and then you are, no pun intended, sidelined by all of these other things. That's fun. So, doing COVID testing and then doing administrative work and all of those things, you are no longer doing the thing that you got into the field to do. And that probably takes from the heart of what you really want to be doing. So when you're doing something like telehealth, while it's somewhat the same and it's similar, it just doesn't give you the feel like it's just not, it's not the same. It's close, but it doesn't give you the what you got into it for, being close to the patients and being able to really do what you do.
I think it's another example of, we get a new hammer and everything looks like a nail, right? So it is a great new technique to use, probably in moderation, and like Tom suggested, setting boundaries, which is something that a lot of people don't do well, let alone athletic trainers. And I guess I can speak to my time working at the collegiate setting, the Division I setting with teams. It was actually the norm that if somebody had an issue at 3 a.m., I was supposed to know about it, because in that role, for better or worse, I was supposed to be their first stop for all things health related. And part of that was a liability standpoint, because then if they went on and got care from somewhere else, and we couldn't track it, we would then, have to do all this legwork to find out, well, what have you done already? And how do we ensure that what we're deciding to do doesn't negatively affect what sort of care you've gotten already, and numerous other potential circumstances there. But I think that's a really great point that you've brought up, that telehealth is great when used appropriately, and that's something that we will probably need to learn and feel out, and all at the same time learning how to set boundaries, because to your point, Meredith, we as athletic trainers, a lot of us got into it because we like to help other people, and it's hard to put a line in empathy that you're not going to cross, because it seems like very much a gray area in I can help, so I should. And that can certainly make it difficult to draw those boundaries.
And I would two kind of conflicting points, but if we get into the part of burnout, well, then we start going into apathy and we move away from that caring piece anyway, right? Sure. And leave the profession. So there were a lot of athletic trainers who said this was it, like they're leaving the profession. And so I think that's not helpful either, right? But and on the flip side of that, though, the pandemic, and some people found that silver lining in being furloughed or probably not terminated, but furloughed, because they were like, wow, I'm actually home. Like I can, get to all those house projects I have had on the list for a while, or, and I think we're finding that there are some things we can do from home, right? And like, maybe it's that 4-day work week now, or, if we're sharing patient load versus sport coverage. And again, that's not for everyone either, because sometimes people get into athletic training for specific patient populations. So I think everybody has to find their own, sweet spot. But if there are things that we can be doing from home, those administrative pieces, or if it's a follow-up appointment versus an initial hands-on full evaluation, or a consult, or those pieces, again, I think you're right, like it's not an all or nothing like tool. It's just a tool that perhaps we can get comfortable enough using in order to provide quality care, and whether that means that it's protecting the provider, right, which improves patient care sometimes, or it's actually could be more timely, right? So telehealth could go in the other direction where if we set boundaries and, you can schedule an appointment during these times, we can see you more quickly. So, off season, summer, whatever it might be, it could be helpful.
3 a.m. That sounds difficult.
Would you say?
3 a.m. sounds difficult.
Yeah.
It happens.
But it does sound like a burnout type situation.
Right. And college students are not always known for making responsible decisions.
At 3
So
a.m.
many are, but all of us make bad decisions, right? As evidenced by some of the responses to the survey here too, right? Maybe health promoting behaviors are not always at the forefront of decisions we make as human beings. So in the interest of time here, we've got just a few more minutes. I guess I'd like to provide a couple minutes for each of you to maybe give a final parting thought. And maybe we go with Tom and then Meredith Neville and then Meredith Madden.
Sure.
Yeah, that's perfect. I actually have another meeting at 1, so that works perfect. Thank you for doing that.
Yeah.
Yeah, this was a fascinating study. I unfortunately don't think, I'll talk for Meredith Madden and I, as we're the two athletic trainers of the authorship. I don't know that we were incredibly shocked by the findings. I think we were probably disappointed in the findings, but not overly shocked by them. So, that's unfortunate, but the pandemic was hard, and it was hard for everyone, regardless of whether you're providing patient care or not. Speaking from a faculty perspective, our second year graduate students went away for spring break and I never saw them again. And I still haven't seen them since because I've not been to an in-person meeting since then. I will finally get to do that here coming up very soon. And I'm super excited about that. But, they just kind of vanished. It was the most interesting time in my life. And, then all of a sudden it was, hey, you're going to put your classes online. It's like, okay, well, some of those are pretty straightforward and I can make that happen, right? I can create videos and all kinds of good stuff. But then how do I teach palpation skills if I'm not physically present, and trying to figure out those kind of challenges? So I think all of us have had to deal with a pivot of some degree or another. And, it's been a difficult, 2 years, and hopefully people are coming out better than they were when we went in. They've in our work, we've found that they have learned some things that they will carry forward, and hopefully those will outweigh kind of the damages that were done along the way.
Thank you.
Thanks, Tom. That was great. I think some of the take home that was really fascinating was that the newer athletic trainers to the field were the ones that were really, really leaving, that most affected by this and thinking really about leaving the field. And I think that crisis needs to be addressed in some way. I don't know what the answer is to that, but I think that's concerning for the field. And obviously it's not exactly my field, but I think that was maybe surprising, probably shouldn't have been surprising, but the incredible impact that all of this has had on athletic trainers was probably larger than expected. I think the positive coping skills was really, really great to see. I think that was really good. But the high level of burnout was not great.
Yeah, I mean, I agree with Tom and, kind of Meredith's last point. We knew that, right? So those pieces are not surprising. And I think, for me, I think for athletic training, right, we're adaptable. Like the things that make us great are we're creative, we're adaptable, we care, right? And so I think those are our strengths that we need to have taken from this and move forward, but also recognize that like we're not going back probably to like the way things were, right? And so we need to use this to learn from it and figure out what worked well and maybe what didn't, and how can we as a profession support our clinicians, across the board, especially those who might need additional resources, especially supporting our early professionals. I think almost every early professional within the first two, I think they were like the 1 to 2 years of experience, basically said, this isn't what they wanted, this isn't what they expected, and they're going to do something different. They didn't say what that was, but and I think so, instead of leaving the profession, right, and having that great resignation and in those pieces, what can we do as a profession or a healthcare system to make it better, right, for the provider? And I think it's that, go back to one of the first things I said, it's that systems approach. It's the quadruple aim of that new piece of the provider well-being and finding joy in work, because that ultimately, putting yourself first, or our own well-being first, will lead to those better patient outcomes. That's what we got into the profession for. And I think also maybe more resources on that administration piece, because I think that's not everybody's favorite thing. It's my favorite part of athletic training, but I think it's everybody else's least favorite part. And so how do we support athletic trainers in those pieces? Because they are actually really important in situations like this, to get more resources, to show our value, and to make it a better work environment so that we can do the things that we love and be more engaged in that direct patient care. So, I mean, for me, it's the admin piece, it's the quality improvement piece, and kind of not adding to our plates, but making our plates maybe more balanced or more efficient. So I think that's what I took away from it, or hope that others can.
Sure. Well, that's fantastic. And I guess I'll say the final word is just thank you again very much for coming and sharing your expertise and your time, and for creating this great conversation around obviously a very important topic. And so I, like many on the call and off the call, are excited about what comes next for you and your line of research. And so I'll be looking forward to that in the not too distant future.
Thank you.
Right.
Thanks for having us.
Mhm.